All right, welcome everyone. In today's clinical masterclass, we are jumping into a skill that is just so crucial for patient outcomes, postural drainage.
So let's start with a really important question. What do you do when a patient's cough just isn't cutting it? For those folks with mucus trapped deep down in their lungs, what we call retained secretions, a simple cough just won't be enough. And that is exactly where postural drainage comes in.
So what is it exactly? Well, at its core, postural drainage is this really clever physiotherapy technique. It uses specific patient positions and, honestly, the simple, super reliable force of gravity. The whole goal is to get that mucus moving from the tiny little airways into the bigger ones where it can finally be coughed out or even suctioned if needed. Okay, let's break this down. If you're going to remember just one thing from this whole explainer, make it this: power equation. Seriously, it's the entire concept in a nutshell. We take the right position, we get gravity on our side, then we throw in some active techniques like percussion and vibration. And what do you get? Effective mucus removal. See? It's a systematic approach, and believe me, it really works. So here's our game plan. We'll kick things off with the why, the goals, then we'll cover who this is for and who it's not for. After that, we'll dive into the core techniques, the step-by-step procedure, and wrap up with a couple of final steps that make all the difference. All right, first up, the why. Let's get right to the purpose. Why are we even doing this? What are the clinical goals we're trying to hit? And the goals here, they are so important. Look, we're not just getting rid of some mucus. We're actually preventing nasty infections that can fester in that stuff. When we do that, we improve oxygenation, which in turn reduces how hard the patient has to work just to breathe. And maybe most importantly, we help prevent something really serious called atelectasis. That's when lung tissue actually collapses. Every single one of these goals is vital for getting our patients back on their feet. Okay, next up is a really critical step, patient selection. Knowing who's going to benefit from this is just as important as knowing who could actually be harmed by it. So this section is all about the indications and, of course, safety. Now, this is so much more than just a classic exam question, right? Think of this as your critical safety checklist. On the left, you've got the folks who really benefit, patients with conditions like cystic fibrosis, or maybe post-op patients who just can't clear their lungs on their own. But the column on the right, those are the absolute no-go contraindications. I mean, trying this on a patient with an unstable spine or high pressure inside their skull, it could be absolutely disastrous. These are the non-negotiable rules of the game. So like we saw in our power equation, positioning is the foundation, right? But it's not the whole story. To make this really, really effective, we boost it with a couple of other key hands-on techniques. The two big ones are percussion and vibration. Now for percussion, think of it as rhythmic clapping. You cup your hands to create a little air pocket and you rhythmically tap over the lung segment. It's a mechanical way to just shake that sticky mucus loose. Then you have vibration. While the patient is breathing out, you apply this gentle, shaking pressure. It's like you're guiding that loosened mucus up and out of those smaller airways. Just remember two key things. Always, always avoid the spine, and only vibrate on the exhale. And this, right here, this is it. This is the single most important rule to remember. You could call it the golden rule of postural drainage. Whatever part of the lung you're trying to clear, you have to position the patient so that segment is the highest point. That way, gravity becomes your best friend, pulling all those secretions down toward the larger airways where they can be cleared. So let's start at the top, with the upper lobes. These are pretty straightforward. To drain the very peak, the apical segments, the patient just sits upright. Easy enough. For the back parts, the posterior segments, they lean forward over a pillow. And for the front, the anterior segments, they just lie flat on their back. See? It's all pretty intuitive when you think about that golden rule. Okay, moving on to the middle sections. Now it gets a little more interesting. To drain the right middle lobe, you have the patient lie on their left side, but with their feet elevated, so their head is angled down. You'll hear this called the Trendelenburg position. And to get the lingula on the left side, you guessed it, we just flip it. The patient lies on their right side, again, with their head angled down. And now for the big ones, the lower lobes. These are the largest segments. For the superior or top parts of the lower lobes, the patient just lies flat on their stomach. But for the very bottom sections, the basal segments, we bring back that head-down Trendelenburg position. Now, depending on exactly which basal segment we're targeting, the patient might be on their back, their stomach, or their side. But in every single case, what guides our choice? That's right, the uppermost rule. All right, we've covered the why, the who, and the how. Let's put it all together now and walk through the complete, step-by-step procedure. So here's the entire workflow. Before you even start, you've got to explain everything to the patient, get a set of vitals, and super important, make sure you wait at least an hour or two after they've eaten. During the procedure, you'll hold each position for about 5 to 15 minutes, and all the while, you're monitoring their oxygen saturation, their SpO2, and just keeping a close eye out for any signs of distress. And afterwards, you're not done yet. Now's the time to encourage a really effective cough, help them with oral hygiene, and of course, document everything you found.
Okay, let's zoom in on two final steps that are absolutely critical for success, but you know what? They sometimes get a little overlooked. We're talking about the quality of the cough and the patient's hydration.
Because here's the thing, not all coughs are created equal. Take the huff cough, for example. It's way less tiring for the patient, which makes it perfect for someone with COPD. Then you've got a diaphragmatic cough, which uses the abdominal muscles to generate a much more powerful, effective clearance. Teaching the right technique is what makes sure all that mucus we just worked so hard to loosen actually comes out. This quote just says it all, doesn't it? It's a very important but often ignored topic. You can do every single position and technique perfectly, but if that patient's secretions are as thick as glue, they're just not going to move. And that brings us right to this magic number, 2 to 3 liters. Now, unless there's a specific medical reason not to, encouraging this much fluid intake every day is absolutely fundamental. Proper hydration literally thins out the mucus. It makes it so much easier for gravity and all of our techniques to actually work. Honestly, it can be the difference between a really difficult procedure and a successful one. Okay, so let's wrap this all up. What are your key takeaways? First, remember that power equation. Second, safety always comes first. Know your indications and your contraindications. Third, never, ever forget the golden rule. Drain the uppermost area. And finally, don't forget that the job isn't finished without an effective cough and proper hydration. We've gone through all the technical steps. We've mastered the protocol. But I want to leave you with one last thought. Let's be real. This can be an uncomfortable, pretty tiring procedure for a patient. So, beyond all the science and the steps, how can your empathy and your communication completely change that experience? How can you ensure not just compliance, but genuine comfort and trust? Because that, right there, is often where good clinical practice becomes truly great patient care.